The world we live in today can be a very scary place. Drugs have become such a downfall in our society, but it's not that different from how things were almost 100 years ago. Alcohol prohibition started in the early 1900s and thus began America's war on drugs. The substances of abuse have changed over the years, but one thing has remained consistent. Society has consistently fallen into dark times with the new popular drugs. So we must ask ourselves, how do we put an end to this? How can we get a hold of this terrible situation that keeps evolving into more problems for our society? America's war on drugs has been going on for decades. It dates all the way back to alcohol prohibition of the 1920s and 30s. Research has shown that with the prohibition of alcohol, there was actually a spike in alcohol consumption. The prohibition actually encouraged the formation of the mafia with their idea to seize an opportunity to supply what the American people demanded. As a result, crime spiked as well. There was now an entire industry of crime, including murders, money for guns, rival turf wars, and wars with the police that were trying to contain the epidemic. Once the prohibition was repealed, crime went down. This should have been a lesson for the more current war on drugs. Marijuana began everything when, in the 1970s, it was classified as a Schedule I narcotic along with heroin, which has no medical benefit. Things began to change when California legalized the sale of medical marijuana. There was a $108 million tax boost due to the legalization of marijuana. Is this the answer to other drugs such as crack cocaine, and heroin going to be the same? Probably not. But the evidence proves that with more than $1 trillion spent on this war on drugs, that we need to be approaching this differently. After the years of prohibition, not only of alcohol, but all illicit drugs, the consensus is that it is creating more harm than good. There is now a great public health risk, corruption in government, increase in organized crime, and money laundering for terrorist groups. It is proven that in states that have legalized the sale of marijuana, there has not been an increase in use. The product is regulated by the government, it is taxed, and the county, city, and state all benefit. The conclusion that we face here is that either these sales of drugs remain in the untrustworthy hands of criminals, or the government steps in and regulates it. The answer is clear. We cannot keep doing the same thing and expect a different result. We must take a new look at these circumstances that we are facing and adjust for the greater good. The Trump administration issued a stark warning to Colombia regarding the war on drugs. They said Colombia needs to improve their efforts to reduce coca cultivation and cocaine production. If they don't, they run the risk of failing to adhere to its obligations under international counter-narcotics agreements. The warning from the United States was severe but necessary. It is reported by the DEA that the United States will have the highest cocaine supply and usage in 2018 than in the past decade, which is a direct consequence of the Colombian government's policy decisions. Colombia has been making efforts to reach a peace agreement with the narco-terrorist Revolutionary Armed Forces of Colombia. Colombia is the largest supplier of cocaine to the United States. As a result of the agreement Colombia made with FARC, the coca cultivation and cocaine production reached its highest levels ever observed in 2016. The Trump administration statement on Colombia demonstrates that the White House is intent on recapturing the initiative on combating drugs in the Americas. We may never be able to totally eradicate the drugs from our countries, but we must have a moral responsibility to do everything possible to recommit ourselves to this effort. America has found itself in the worst drug epidemic in history. Drug overdoses, mostly from increasingly lethal opioids, now kill more people than guns in traffic accidents. Somewhere between 59,000 and 65,000 people died of drug overdoses in 2016, a nearly 20% spike in a single year. The Attorney General, Jeff Sessions, has redeclared the war on drugs. This is a 5-decade-old project that has repeatedly failed over the years. Over the past several decades, President Nixon, the CIA, the DEA, President Reagan, President Clinton, and President Obama have all made efforts in the war on drugs. Now President Trump seems intent on doubling down on the war on drugs. This war on drugs has already cost the American taxpayer over $1 trillion, and our nation's jails, prisons, and hospitals now overflow with the ranks of its combatants and victims. Most Americans believe that there is no way to win this war, but we must try. The war on drugs was supposed to decrease the effect that heroin was having on the American people. Unfortunately, the opposite has happened. From 2011 to 2014, there was an increase of more than 6,000 deaths due to opioid overdoses. The cause of this opioid epidemic is largely because of the overprescribing of opioids, but also economic climate and the lack of a good healthcare system to address problems without the use of drugs. Most physicians receive little training in how to handle the addiction to opioids. Thus, they continue to overprescribe these drugs, only contributing to the epidemic. We need to change things dramatically so that we can reduce the number of lives unnecessarily lost to overdoses. President Trump has declared America's opioid crisis a national public health emergency. The opioid epidemic is being called the worst public health crisis in American history, with its horrific consequences exacting itself across the nation. As the number of fatalities have gone up, the face of addiction has shifted as well. Opioids are killing white Americans at double to triple the rate of their Black and Hispanic peers. As well, the age group that has been affected the most is the late bloomers, which are age 55 to 64. The number of opioid prescriptions has fallen every year since 2012, but the death rate from street drugs like heroin and fentanyl is rising faster than ever. This crisis will continue to affect Americans of every age, from babies being born addicted to in-pain elderly people. This rippling effect leaves communities grasping to find a way out of an epidemic that shows no sign of letting up. As we have studied the past, we have learned that drugs and alcohol have been a problem since they came into existence. As a society, we have approached these problems head-on with little resolve. It is now our duty to learn and proceed with better ideas to eradicate this problem to help prevent the rampant deaths of so many people.